Hey, this is Dr. Scott from Transcriptions and Health Optimization Medicine and Practice. I just wanted to talk briefly today about a patient that I saw regarding headaches and cognitive impairment. This is somebody that was in their mid 40s or 50s, doing relatively well until they came and presented to my hyperbaric consulting clinic and was talking about having concussions when they was a kid. And actually, this is the main thing. Nobody had actually ever asked if he had had concussions as a child. And he had some nasty concussions as a child. And these concussions actually significantly changed his life in various ways, especially when he was younger, but he was able to kind of make it all work and kind of get things together, go to college and get a good job and have a family. But by his mid 40s, he was having a hard time with headaches, with cognitive issues. He had seen regular doctors and nobody really knew what was going on. And then I just asked him the question, had he had concussions in the past? And I was the first doctor to ask him this question. And once it was kind of understood that he had these concussions, it was very likely symptomatically that he was having symptoms related to these concussions when he was younger. So this is a very important point. Concussions happened when he was very young, though. So it's not like going directly into a hyperbaric chamber is a good idea. In fact, the best way to kind of address this is to optimize the foundational biology that's actually allowing his cells to make energy well in his mitochondria or not. So vitamins, minerals, nutrients, and cofactors that are all responsible for energy metabolism. So if you're doing this, you can see that when the cells are supported, and then you provide the system more oxygen in a hyperbaric chamber, it can be transformative to somebody's health. And this particular patient, his symptoms actually significantly improved. So he wasn't having any cognitive issues anymore. His headaches vastly improved as well. We changed his diet, we changed his lifestyle, we got him off alcohol. The deal here was asking the right questions is so important, and then looking at foundational biomarkers to help people. This is the kind of person that had went to the regular doctor, and he had normal labs. His lab looked fine. But when I looked at his metabolomics, which is the study of his real-time actionable data that's happening in the cellular level, his mitochondria were under significant stress. He had oxidative load. He had poor antioxidant status. He had more going on that was all affecting his ability to make energy and his ability to detox as well. So we shifted his diet to be more of a ketogenic diet. We shifted his diet along with his lifestyle so that he was getting better sleep, that he was stress relieving more often, and doing all this really profoundly helped him. Then after about 3 or 6 months, about 3 months in his case, we started hyperbaric therapy. He did about 20 or 30 hyperbaric sessions, and he felt remarkably better. So the key here is to understand that it's not always the right idea to put somebody in a hyperbaric chamber. And this is something that I've learned over the years, many times over. But in addition to this, what is the foundation? How do we optimize that foundation? And that's what health optimization medicine and practice is all about. That's what I do in my concierge health optimization practice. And that's what many of my colleagues that are in practice using the same methods do as well. So the key when you hear a symptom like that, like headaches or cognitive impairment, is to go deeper, not just look at surface levels, but look at metabolomic data, start there, optimize there, then use other tools and technologies as you need to accelerate and improve healing like hyperbaric medicine.